This is Mayo Clinic Talks, a curated weekly podcast for physicians and healthcare providers. I'm your host, Daryl Chutka, a general internist at Mayo Clinic in Rochester, Minnesota. Imagine traveling on a journey through another dimension, a dimension whose boundaries are limited only by one's creativity, a journey which lies somewhere between science and imagination. Consider, if you would, a patient who has suffered a massive myocardial infarction, leaving a significant amount of damaged and non-functioning ventricular myocardium. Treatment for this patient's subsequent congestive failure does not involve diuretics and beta blockers, but rather an injection of the patient's modified stem cells into surrounding viable ventricular myocardium, resulting in the regeneration of new functioning myocardial cells, producing a restoration of the cardiac output. This isn't the storyline of a new science fiction movie, but rather ongoing work by a group of investigators at the Mayo Clinic. The destination of our journey today is regenerative medicine. This Mayo Clinic Talks podcast is one of several we will devote to this incredible field. Today we'll be discussing an introduction to regenerative medicine with Dr. Andre Terzic, the director of the Mayo Clinic Center for Regenerative Medicine, and Dr. Fredric Meyer, the executive dean for education at the Mayo Clinic. Gentlemen, welcome.
Thank you for having us.
Yes, thank you.
This is a rather new field, and for our listeners who may not be all that familiar with regenerative medicine, why don't you tell them exactly what this is? What is regenerative medicine?
First of all, thank you for introducing the field to your audience. I think we are very excited to share the podium with you and basically highlight some of the advances that the field has seen. The way to define regenerative medicine is probably to see it as a field that aims to restore form and function. So it's a very broad definition. The therapies today have historically been more linked to be able to reduce symptoms of disease, mitigate disease symptoms. And here, with the advances in regenerative technologies, we are finally able to utter words such as curative solutions. So from a model of caring for patients, we are increasingly going towards curing disease. That's really the transformative aspect of regenerative medicine.